Dr. Heather Hirsch and welcome back to my YouTube channel. In this week's video, I want to talk to you about your follow-up visit and specifically your first follow-up visit after you start on hormone replacement therapy. It occurred to me this week as I was seeing a patient, actually as a second opinion, that the follow-up visit is so crucial in making sure that you're on the right track when it comes to your hormone therapy regimen, your journey, your, just that feeling of thriving and feeling good, which I kind of call your confidence in your regimen. That's what I want to go over in this video today. So if this interests you, stick around. If you don't know me, I'm Dr. Heather Hirsch. I founded the Midlife and Menopause Clinic at the Brigham and Women's Hospital back in 2019. I am the author of the book Unlock Your Menopause Type, and I now have a private telemedicine practice, the Health by Heather Hirsch MD Collaborative. I know lots of the word Heather, and we are expert clinicians who are seeing patients in over 25 states across the country, and probably by the time you're watching this, growing. If you want to go right to expert care, you want to also get my amazing course, all the amazing providers, 1 hour visits, click the link in the description below. The first thing that you want to cover in your follow-up visit is, are you feeling better? Now, I always say the goal of treatment is to feel 70 to 80% better. And a lot of time women ask me, how long is this going to take? Now, this can take varying different lengths, but usual follow-ups are anywhere from 6 weeks to 12 weeks or 3 months after your initial visit. It really honestly depends on your provider's availability. 6 weeks is great when the provider has time. It's a great time to just check in, because usually after about 2 to 4 weeks being on hormone therapy, you should start to see some changes. Hopefully there are improvements and no side effects, but 2 to 4 weeks is going to give you a lot of information. Now, if you're at a busier clinic and you have to maybe go 3 months out, then there should be lots of things that you know by that time about your regimen. And again, the first thing we're talking is it working? So I always tell my patients that you want to strive for 70 to 80% improvement in your symptoms. Now, some women will get upwards of 90, 95% improvement. And if that's you, yes, for the win. But again, not everything is hormonal. And so, 70 to 80% is a significant amount of improvement that's usually the minimum that I want you to feel improved by. So when patients tell me they feel 35% better or 50% better, that's good, because it means that we're going in the right direction, but that can be tweaked. So potentially it means the dose needs to be increased. Maybe it means that progesterone needs to be decreased. It just really kind of depends. So estrogen can be increased, specifically if you feel like it is treating your symptoms 50%. It's treating my hot flashes, it went from 10 to 5, 50%. Well, I know that if I increase the dose a little bit, I can probably get you to that 70 to 80% improvement. Now, maybe they're also looking at if you have any side effects. So did you get any breast tenderness, any bleeding, any bloating, any headaches, any nausea? These can be side effects from either the estrogen or progesterone. And then you want to try to remove the offending agent or change to a new formulation. So there's many different formulations of HRT. There's conjugated equine estrogens, there's bioidentical estrogens, there's synthetic progestins, there's bioidentical progesterone, there's so many different formulations. And there's also different routes. So the next thing I do at your follow-up, so point number 2 is make sure that you actually like your regimen, it fits into your lifestyle, and you feel like you can really thrive with this. Now, let me give you an example. So I routinely will prescribe the patch for my patients. They might come back and say, I really like this, but it's leaving a ring around my stomach when I take the patch off, or I just forget to put it on, and I'll be wearing it for 6 days before I remember. And that is not a great sign. And the good news here is that those are things that are very easily fixable. So for example, if you're forgetting something, twice a week, there's actually a weekly patch. Or if you've got a weekly patch, but you feel like it's sort of running out, or you're starting to have symptoms before those 7 days is up, maybe you need to go to a twice weekly patch. Or maybe you need to go to a daily option, something like Evamist or estrogen gel, because you just need to do something every 24 hours. And that can be really, really helpful to discuss at your follow-up. So all this time, I really recommend that my patients journal and track both improvement, how much improvement, what side effects they're having, if any, which is the first category of how you're actually doing. And then number two, how do you actually like this regimen? You know, are you a big traveler? Is it easy to travel with? Are you a night shift worker? Do you forget when it's been 3.5 days or 7 days? Maybe even, you know, day to night is difficult because I have a lot of patients who are, you know, traveling in different time zones a lot. So the second thing you want to be journaling and tracking is like, how is this actually fitting into my lifestyle? Another example of this is vaginal estrogens. Vaginal estrogens are really, really commonly prescribed in my telemedicine clinic and practice. That's because 40% of women who use systemic hormone therapy will also need some local vaginal estrogen. And, you know, that's something that can be messy, or for patients can forget, or expensive, and so they never picked it up. Whatever it might be, we want to discuss those with you at your visit so that we can ultimately decide what is going to best fit into your lifestyle. The next thing we want to do is make sure that you are really confident in your regimen. And a lot of times I'm going over questions that might come up. I always say one of the biggest risks about being on hormone therapy is breast tenderness, bleeding, and your friends and family just harassing you for your choices. Now, that is completely unnecessary, not only because FDA approved hormone therapy is extraordinarily safe, it is the most efficacious medications that are FDA approved to treat vasomotor symptoms, genitourinary syndrome of menopause, and so many other symptoms, but there's a lot of deep-seated biases and myths. Also, it's no surprise that on this day and age, you can go to any social media platform, you can search hormone therapy, and you are going to get a plethora of different answers, right? You're going to have friends and family telling you that you maybe should or shouldn't be doing this, and then you're going to go on social media and really just be very confused about what is the best type of hormone therapy. Is it oral? Is it transdermal? Is it bioidentical? Is it compounded? Is it injection? And there's just a plethora of options out there. And a lot of times this almost like doubt can start between the first and the follow-up visit, because as a patient, you're really actively researching potentially what you are doing. And we want you to feel so confident in your regimen, so confident in what medications you're choosing to put into your body and why and how safe they are. So I like to spend a lot of time with my patients reiterating that data, refreshing their minds on why what they're taking, FDA approved hormone replacement therapy, is the best option for them. Now, I have tons and tons of videos on this safety and efficacy of hormone therapy. In fact, I'll link this one here. I would go recommend watching that if you only had a short amount of time in your follow-up. Now, personally at the collaborative, we do half-an-hour follow-ups and we do hour-long initial visits because we know that the follow-up is really, really important, and 15 minutes is just simply not enough. And that's pretty routine at large academic medical centers based just on the way healthcare as a business overall in these large institutions are run. Now, if that's all you've got, you're gonna make excellent use of it. You're gonna come in with your notes, you're gonna come in with your questions, and you are going to come in super prepared. Now, I would say as a bonus, the last thing that I do with my patients is I like to touch on the symptoms that have not yet improved on hormone therapy. So maybe that's hair, maybe that is weight, maybe that is libido. And then I like to say, well, now that we have tackled this, and this symptom, right? So maybe it's vaginal dryness and hot flashes and sleeplessness. Let's now tackle the hair and the weight or whatever symptoms it might be. And in those, I like to talk about lifestyle. I like to talk about supplements, and there are additional medications that can be used to help things like hair and weight and all the things that we as women care about. I really have a great video on hair here, and I'm about to make one on weight loss medications and supplements. If you want one on that, let me know. It's been on the queue for a while. It's also a great place to add any supplements as well, just to your regimen, because if you're at that 70 to 80% improvement, supplements can sometimes just kind of knock you up to that 90-95% improvement in quality of life. Again, I'm Dr. Heather Hirsch. I love making these educational videos for you. Thank you so much for watching my videos. If you like these, please like and subscribe. It is always free to do so. That tells the YouTube algorithm that this is one of the best places to get evidence-based information on all things perimenopause, menopause, hormone therapy, and more. I would love to see you as a patient. Again, my telemedicine practice is open in so many states. I also have tons of resources, and I think my book, Unlock Your Menopause Type, is pretty amazing. Everything is down in the description below. Let me know what else you guys would love to learn, and thank you so much for watching. See you next week. Bye.